Hello everyone, my name is Macy Arthur and I am an MSN student for a family nurse practitioner. A clinical area that I found that could use improvement is in the area of heart disease. According to the CDC, heart disease is the #1 killer of women in the United States. Specific to my region of Kentucky, Harlan County has very high rates of heart disease. If you draw your attention to the graphic at the bottom of my poster, you will see that the heart disease deaths for Harlan County residents are 281 per 100,000 per year. And the prevalence of hypertension among Harlan County residents is 48% compared with 39% being the total that Kentucky has. This is an area that could definitely use intervention by advanced practice providers. Many studies suggest a Mediterranean diet is good to follow for primary prevention of heart disease. Evidence from 4 studies, which you can view on my reference list, support that while following a Mediterranean diet, cardiac events can be lessened, BNP can be reduced, and systolic and diastolic blood pressures can be reduced. One project that I would like to propose would be to recruit clients 21 years of age to 62 years of age from the Harlan County area that are at high risk for heart disease, have a family history of heart disease, are not pregnant, and have a systolic blood pressure less than 130. Recruitment will be done by posting flyers, and on those flyers, they will have a website and an email in which those clients can either get in touch with myself or they can get in touch with the Daniel Boone ARH Clinic, which is where all of the project guidelines will take place. After informed consent is given, the clients will have their first assessment of blood pressure and lab work drawn. They will also be informed at this time about the guidelines that they will have to follow for the Mediterranean diet, which includes vegetables, nuts, seeds, legumes, potatoes, whole grains, breads, herbs, spices, fish, seafood, and extra virgin olive oil. In moderation, participants can eat poultry, eggs, wine, cheese, and yogurt. Red meat should be eaten sparingly. Participants must report to the Daniel Boone Clinic every 3 months to have their lab work drawn, ask any questions that they have about the Mediterranean diet, and to have their blood pressure screened. The diet plan will need to be followed for 1 year, and upon the 5th visit to the clinic for lab work and blood pressure screenings, final assessments will be done and information will begin to be compiled. Labs and blood pressures will then be placed into an Excel spreadsheet and trends will be looked for. The goal is to have a reduced BNP, systolic blood pressure, and diastolic blood pressure to be in normal range, which is 100 to 120 over 60 to 90. And for cholesterol levels to be reduced, HDL should be greater than 60, LDL should be less than 100, and total cholesterol less than 200. At the end of the study, in the month of July 2019, and you can view my project timeline in the middle graphic on my poster, results will be disseminated to the stakeholders. And the long-term goal is that we would hopefully see a downward trend in hypertension prevalence and heart disease-related deaths for the residents of Harlan County. Please let me know if you have any questions. References can all be found on the right side of my poster. I hope that this information can be useful to you and that in your future practicing of nurse practitioner that you would want to encourage your clients to follow a Mediterranean diet for primary prevention of cardiac disease. Thank you.